All right, so we're going to talk about dog ears. What are dog ears? Well, they sound really cute, don't they? Like little fluffy ear dogs and stuff like that. What dog ears are after surgery is they're an excess skin fold that can sometimes happen after any surgical procedure. They can happen anytime you're removing skin. So the skin you can think of like a fabric, and we remove it and it creases and it folds. And sometimes we do all these little tips and tricks and things and design our incisions in such a way that they don't create excess folds at the edges where we stop. On a tummy tuck, what we do is we take a big chunk of skin out of the bottom of the abdomen, we lift up the abdomen, we pull down really tight. But at the end, right where you have to end the incision somewhere, we end it in a little point. And what can happen sometimes is if the person's skin has a fold that's not normal or the point isn't designed correctly or for any number of reasons, you can end up with a little bit of a skin fold right at the end, usually on the outside, kind of towards the flanks. That's called a dog ear or a dog ear deformity. We call it in plastic surgery. And it's pretty common. I would say it happens maybe about 20% of the time or less. It just kind of depends on how the people are before the surgical operation. And there's a lot of things you can do. What I like to do at the end of surgery to try to correct dog ears, sometimes you can do a little bit of liposuction in that area right at the end of surgery, and that'll bring it in a little bit, make a little bit of extra skin less noticeable. But the best way to deal with a dog ear is wait. So immediately after surgery, a lot of people have a ton of swelling, particularly on the outside, right where we operated. A lot of times, if you just wait, the dog ear goes away. It's just swelling related. So a lot of times after surgery, we don't do anything for months and months and months because if we can avoid doing something to you, it'll go away on its own, then that's what we should do. But occasionally it doesn't go away and there's a little prominence or a point of skin. The easiest thing to do is to remove it in clinic, just like it's a mole. It's really simple to do. You just numb up the skin, you make it a little bit longer, extend it out, and remove the extra skin. Usually takes about 20 minutes, 10 minutes or so. It's really easy. There's almost no recovery, and it's a really quick and easy fix. Dog ears can happen to anyone. They happen to every surgeon. I think as we get more experience, the more you do, the less dog ears you end up having. But even I get dog ears from time to time on the breast, sometimes on the abdomen after a tummy tuck. But they're a real quick and simple, easy thing to do. The only trade-off to fixing a dog ear is you gotta undergo quick little local procedure, and you gotta extend the incision a little bit so you make the scar a little bit longer. Yeah, so that's dog ear. Funny little term for a little pinch of skin at the end of a lot of plastic surgery procedures. But luckily, when it happens, it's usually pretty easy to fix.